I'm Oscar Montenegro, your host of Professionals in My Car. If you have questions or comments regarding leadership, please email me. I enjoy hearing from our viewers. If you have a specific organizational or individual leadership challenge, I do offer one-on-one coaching and management consulting services. I want to introduce to you my next guest. This individual is originally from Clay Center. He did his undergrad work here at Kansas State University and did his master's and doctorate work in physical therapy at the University of Kansas. He is also certified in the McKinsey method protocol, which is a spine rehabilitation method. When he graduated, he worked in various orthopedic therapy roles and then moved to Manhattan. When he moved to Manhattan, he started working for Mathis Rehab Centers, and within a year was appointed a director role. And so now he oversees the Manhattan Clinic and the Junction City Clinic as a director of clinical services. I'm excited to introduce to you my next guest, Dr. Luke Henry. Let's go. Professionals in My Car. I'm your host, Oscar Montenegro. Today I have Dr. Luke Henry, Clinical Director for Mathis Rehab Centers. Doctor, good to have you on.
Thanks for having me.
Thanks for getting in the hot seat. Let's start it off. Tell us what you specialize in.
So we specialize in outpatient orthopedics. Our clinic really sees a wide variety of patients, but mostly all outpatient orthopedics. So a lot of pain, a lot of back pain, neck pain, shoulder pain, a lot of post-surgical rehab.
Okay.
Is really what our focus and our niche is.
Okay. And so what does it take to be a leader in this industry? Meaning, how do you set yourself apart from the competition?
I think the primary thing that we do from a physical therapy standpoint is, creating a high quality service for our patients. And so, patients that, come in that are in pain, if they receive what they need from us. So get out of pain, get back to function, get back to living, return to an active lifestyle. If we can offer that and help them meet their goals, that's what we think really sets a clinic apart.
And it seems to, you've been, Mathis Rehab Centers, has it been around how long now?
In the current state, we've been around for 15 years.
Okay. So this method seems to have, works, obviously.
It has been pretty successful.
Okay, good. So tell us this, what does it take to be a leader of people in this business? Meaning, you as a clinical director, how do you get staff to execute on the company's common goals?
I think several things play into that. Probably number one thing is defining what those goals are, whether it's through a mission or a vision statement, and making sure that they understand, what we want the clinic to be, what we want the patient experience to be when they come in, how we want to portray ourselves, to the population that we serve, and then, with dealing with professionals. I mean, all of our staff are doctorate trained physical therapists. So I think with professionals, as long as they understand that and set up some guardrails to, make sure they stay within those, but then let them treat patients and provide high quality care that they're trained in, because all of our training is a little bit different. There's a lot of ways to fix a back pain but just making sure that, they're providing high quality care to each patient that comes in the door.
So it sounds like you let your therapists find their style. Obviously, there's a concrete way to treat certain things, but each individual tends to form their own style of treating the patient, correct?
Exactly. Like I said, there's many ways you can go into many physical therapy clinics across the country, and you're going to get similar care in a lot of them. I mean, there should be some, good quality care is going to involve some sort of manual therapy, some hands-on care,
okay,
some specialized exercise to correct whatever your ailment is, and then some home instruction to help modify what you're doing at home. And so, as long as they're staying within those guidelines, we're going to allow a lot of freedom to to treat how they feel would benefit the patient best.
Excellent. So as a clinical director, both in Manhattan and in Junction City, what does it take to develop other clinical directors? And so what leadership competencies does a clinical director need to have to be, to have some success?
Yeah, so our clinical directors are all going to be professional staff. And so, most people get in the field of physical therapy are going to be, compassionate people, want to work with people. And so those are the skills that, we don't have to work a lot on. A lot of it will be more of the, business acumen, understanding how businesses run. That's not the education that we get when we go to physical therapy school or any healthcare school in general. We're going to get the clinical skill, but not the business. Like I said, business acumen, business knowledge. So I think helping develop that, understand how the business runs, how things run from an insurance standpoint to a billing standpoint to collections to scheduling, and understanding the totality of how the business runs.
Yeah, that's good. Sounds like it would be very beneficial as well. Last question for you, Dr. Henry. What can people start doing today to get on the path of effective leadership?
I think kind of along the lines of what I was just saying. I think just working on educating themselves. Reading books, understanding how business runs. Even if it's a new staff therapist that isn't sure what their future holds, trying to get in the back office a little bit more and understand what goes on, because it's going to help them as a clinician understanding if we're needing approval or understand when a patient complains about a bill, but it will also help them down the road understand when they're on the other side and having direct to clinic to have a better understanding of how the whole process works.
Excellent. I want to thank you for your time again.
Okay,
Thanks for getting in the hot seat.
Yeah, you bet.
We'll talk to you soon.
Thank you.